Good afternoon, I'm Mike Cherry. We are on the air with breaking news. The governor and other state officials are about to update us on the coronavirus response in New Hampshire.
Today, I just got off a governor's call with the president and the vice president talking about a variety of things from testing and PPE, next steps, both not just here in New Hampshire, but obviously the strategy going forward across the country. So on that, to just kind of pick up where those conversations left, maybe we can start talking about testing, and just in terms of where we are and the opportunities that we're trying to create here in New Hampshire to ensure that we have adequate testing for our citizens as part of the COVID-19 crisis. So obviously we continue to ramp up our testing capacity, something we've been constantly doing since the very beginning of this, going from 50 to 100 tests a day. I think as recently as just a couple days ago, we're now over 1,000 tests on certain given days, and we're giving ourselves a goal, at least in the short term, and working with Health and Human Services, embarking on a community-based testing campaign to increase to 1,500 residents daily in the coming days and weeks, including statewide coverage of long-term care facilities, even beyond Rockingham and Hillsborough counties. The goal is to make it as easy as possible to test residents close to home and ensure that a more complete and comprehensive map of COVID throughout the state is available, not just in the counties, but really working to identify any additional potentials for community-based transmission. Health and Human Services will establish 5 new testing locations throughout New Hampshire to fill the gap for Granite Staters not able to access hospital-based clinics or urgent care centers. They will be located in Claremont, Lancaster, Plymouth, Tamworth, and Rochester, and these sites will still require a provider referral, but will be open for 8 hours a day, 7 days a week, staffed by the National Guard and the Metropolitan Medical Response System, the MMRS personnel that we've been discussing, as they continue to provide a great resource for the state, really since the very beginning of this epidemic. So we're ramping up our testing, and these new efforts will obviously help guide our decision-making, our tracking of the viral spread. We obviously have a lot of very big decisions to make in the weeks ahead, and looking at the metrics and the tracking of the data is going to be very important in determining the strategy and both the short and long-term steps. Also, the state continues to bring in and distribute PPE, personal protective equipment. And in the next 2 weeks, we anticipate sending out over 2.5 million pieces of PPE, specifically masks is where we're really focusing our efforts, to everyone from hospitals, nursing homes, and other areas where there is a need for PPE and where we've identified that need. A strategic push to get our protective resources to individuals all across New Hampshire is well underway, and will continue to do so, continue to bring it in and distribute it as it becomes available. At this time, I think I'm going to bring up the Commissioner, if you don't mind. She can bring us up to speed on some more of these details, as well as our daily public health update. So, Commissioner Shibinette, thank you.
Thank you. Just an update on numbers and then a little bit more on our new testing strategy. Today we will be announcing 75 new cases with no new deaths today. That brings our positive total up to 1,938 with 60 deaths. Like I said, no new deaths today, and over 18,200 people tested in the state. We are currently running, for current hospitalizations, a range from between 90 and 100 people a day. On Saturday, we announced 7 deaths, and 6 of those 7 deaths were in long-term care facilities. 1 was not associated with a long-term care facility. We have 3 new outbreaks to talk about today. 1 at Birch Hill in Manchester, 1 at Crestwood Center in Milford, and 1 at Salem Haven in Salem. Birch Hill has 7 positive residents, 4 staff member for a total of 11. Crestwood has 14 residents and 4 staff member for a total of 18. And Salem Haven has 9 residents, 2 staff members for a total of 11. So our testing strategy has been something we've been working on for about a week with a goal of about 1,500 tests per day. Last week alone, we increased our testing capacity by almost 80%, reaching 1,000 a day this week, which was great. We expect our new testing strategy to be live by Wednesday. And as the governor said, we have 5 fixed locations. In addition to those fixed locations, We will also have our MMRS team continuing to do outbreak testing. We have a civil support team with a collaboration between the National Guard and our MMRS team, who will be doing point of care testing, and that team is mobile. We also have an additional National Guard mobile team. We've contracted with the Visiting Nurses Association to go out and test anybody that has limitations with accessing our fixed sites, so anybody that can't leave the house, maybe has physical limitations. So the VNA are going to go into those homes and take specimens in the homes. Convenient MD still has 11 locations that are up and running. They've also been contracted to do all of our uninsured specimen collection and testing. So if a person is uninsured, they can have a telehealth visit and then arrange for testing at a Convenient MD location. They continue to do our long-term care staffing, which they've tested over 2,000 long-term care healthcare workers in the last 10 days or so. So any residents with any symptoms now, so this is a change for us for sure, that even people with mild symptoms, we're saying to call your primary care physician, and Dr. Chan will be releasing a new health alert later this week to really encourage and recommend that anybody with symptoms at all be able to access testing. So once you call your provider will have a number to call to set up with the department for so basically what we will do is we'll call you back and we will set up the location that's nearest you and an appointment to come and get your specimen collected. I think that's it. Thank you.
Thank you very much, Commissioner. One more area where we want to highlight something that we've talked about a little bit over the past few weeks as folks from all across the state really pitch in, get out of their comfort zone, do things a little bit differently, whether it's in our call centers or at the food bank or in our local communities in a variety of different ways. And delivering life-saving PPE to our workers on the front lines. And that's really the men and women of our National Guard. They continue to do just an outstanding job. Every challenge that we put before them, without a hesitation, without a complaint, they step up and say, well, even if we don't know how to do it, we're going to figure it out in the next 24 hours and get right on it. And it's been an incredible resource for the state. And so what I thought I'd do is ask General Michaelides to come up and join us this morning and talk a little bit about some of the efforts that have gone on and maybe where we go from here. General.
Thanks, sir. For the National Guard, our domestic operations mission is quite simple. It's to save lives and mitigate human suffering. And based upon that premise, the mission sets that we have been tasked to do, we just fulfill. We fill the capability gaps that the state of New Hampshire cannot fulfill. So I'd say on March 21st, we mobilized our first Guardsmen. Today, we have over 500 Guardsmen activated in the entire state of New Hampshire, both Army and Air National Guard. That is almost the second most in our state's history after the Seabrook protest from the late 70s. That's how many soldiers and airmen we have now activated. Based upon that, those numbers, the last 2 weeks, our missions have essentially evolved. The biggest mission that we currently are doing, and we sort of call it steady state, is over 200 soldiers and airmen, and now supporting 3 separate call banks for the state of New Hampshire for employment security. That went from 19 to 200 in less than a week. It was like last weekend. This past week, we just activated another 150 soldiers and airmen. So we've gone from doing call banks, call center support, to steady state operations where we are running the PPE operations, the warehouse operations, for the receipt and distribution of all PPE in the state of New Hampshire. We've now evolved to the New Hampshire Food Bank. For the last 2 to 3 weeks, we've had over 20 soldiers show up every day in Manchester, New Hampshire Food Bank to help prepare, consolidate, and prepare meals for delivery throughout the state of New Hampshire. And this past weekend was pretty amazing. Went up in Colebrook. 20 soldiers participated in the New Hampshire Food Bank to serve over 750 meals for the North Country. That will occur every weekend, every Saturday for the next 4 weekends. It went from Colebrook. Next weekend will be Gorham, Loudon, and Plymouth. We'll have soldiers, to include our cooks, helping make prepared meals for those in need. This past weekend has now evolved to how can we support in the medical arena, specifically the medical tasks that have been provided to us. And we've had 3 sort of line of efforts that we like to call it. The first one is we're fortunate to have a civil support team. Within that civil support team is a mobile rapid testing laboratory. You can see the results immediately. We can go to point of impact for long-term care facilities or those high-risk populations, immediately take tests, and get the results back within less than 10 minutes. That's one effort. The second effort that we talked about earlier was 5 fixed facilities and 1 mobile testing team. So again, we're taking our medical professionals, our EMTs, who are not first responders in the private sector or the outside, using our internal assets and again responding to the need. We're setting up 5 of those fixed facilities, 3 of them are at our armories. What that allows us to do is do drive-in, drive-out testing. A person doesn't have to get out of their car. They go to the first tent. They're meted by the first person who greets them and takes their administrative data. They'll go to the second test where our medical professionals have been trained by Department of Health and Human Services to be tested on those appropriate protocols. Then the third thing we're doing is what we're calling COVID contact mapping. So once again, in the opportunities where the state lacks the resources or capacity, we're providing the manpower and the expertise. So again, we're going to augment at the Grupponi Center in Concord, Health and Human Services with 25 soldiers and airmen to help the state start the contact mapping process of COVID positive cases. So in summary, I'd like to close with just a brief comment I heard from one of my recruiters. And he said to me, he goes, "Sir," he goes, "you know what?" He goes, there's 1.35 million reasons why we serve, and none of it has to do with free college. Thank you.
That's great. That's terrific. Thank you, General. Everyone's standing up and pitching in. I guess we can, before we open up for questions, just a brief update on our GOFER group, which is the Governor's Office for Emergency Relief and Recovery. I always have to make sure I get that acronym right. They continued, former Commissioner, now Executive Director Jerry Little and his team, I think, continue to do really around-the-clock work, working both the Legislative Advisory Committee, the Stakeholder Committee. They're constantly bringing folks in on presentations. We've already moved quite a bit of CARES Act money. We've authorized a lot of CARES Act money through not just my office, but the opportunities as they come through the federal government. The GOFER website is now up and running, I believe. I just want to make sure. And folks can access that website to see all the everything from the presentations and the meetings that have happened through that office to where some of these initial dollars are going to. So it's all up and running. And again, we'll keep enhancing that website, making it a little more user-friendly. It's just been up and running for less than a week now. But again, we wanted to get this stuff out, make sure that transparency is a hallmark of everything we do here in the state. We also have the Reopen New Hampshire task force, I should say, that has been meeting over the past week. And again, hearing presentations. They're hearing more presentations today. I think the barbers and cosmetologists will come in and present tomorrow. They're hearing from the folks that manage the parks and trail system today. So all these different aspects of where we go with our guidance and how we open things up. And I think by the end of the week, we'll have some very decent recommendations in terms of how we're going to move forward, both in the short and long term. Start making steps to that, but again, always making sure that everything we do has public safety first and foremost. All of these guidance and recommendations we make will always go through Department of Public Health and make sure that it is in line with both the guidance that we've received from the federal government as well as the best path forward here in New Hampshire. So with that, we can open up for questions.
Governor, in regards to this new expanded testing regime, is this going to rely on lab-based testing or the Abbott rapid tests? Just describe what you're going to use, and then in terms of the ceiling for testing capacity in New Hampshire, a lot of that seems to be dictated by lab space. What would be the ultimate goal in terms of tests per day?
So the testing, what we've been able to do is broaden out our ability to test in a variety of different levels. So our public health lab, for example, will continue to do 200 or 300 tests a day. That's about what the capacity there is. The availability of outside labs like LabCorp, in particular, working with Convenient MD, has greatly expanded, not just here in New Hampshire, but across the country, and that's given, I think, everybody a lot of opportunity to expand. The hope is that Dartmouth-Hitchcock gets to a point where they can really expand and use their device. They have some great devices over there, but we have to make sure that they have the material so they can expand in terms of what they will be doing as well. And then you have the rapid tests, right, that you've described, which we've been able to expand. We're beyond just the 2 devices with 50 tests each. We have hundreds of tests now available, not the thousands that we would like yet, but at least we have hundreds available. And we'll make sure that those devices are strategically placed around the state to really work with a lot of the institutional facilities or hospitals as we get hospitals up and running, which I think is something that everybody would like to see in short order. So it's really a variety of opportunity. But the access to outside labs, I think, is the biggest increase that we've seen. And as they've been able to get their 10 or 15-day turnaround time to 3, 4, 5 days, that gives us a lot more faith in terms of having that data, utilizing that data, and getting people the results that they need.
But in terms of what you'd like to see,
Oh, sure.
3 to 6
Yeah.
to 9 months from now in terms of tests per day?
So, right now, if you had enough viral transport media and swabs and all the materials that go with testing capacity, and you utilized all the testing capacity in the state, we could do a few thousand potentially if we really opened that up. And so that is really the goal, is to maximize our ability to use every testing device to its fullest capacity. We're not there yet because, again, we're bringing more and more of these materials in per day, and we've had some success doing that, going from 1,000, and the goal is to get up to 1,500 in very short order. That'll give us a lot of very good data. But yeah, there's no ceiling on it, really. We're just going to keep going as hard and as fast as we can, utilize every resource that we can. And as time goes on, we've seen more materials become available, so I have every faith and confidence that more materials will continue to be available to keep reaching for that ceiling. And as we get closer to the ceiling, I'm going to keep moving the goalposts, right? I don't accept, well, we've hit a certain number, so we're okay now. The goal is to keep moving the goalpost and keep challenging ourselves to increase testing capacity. The fact that we're going to a point where virtually everybody with a symptom, providers, we're opening that up for providers, saying, look, if folks have symptoms and want to be tested, you can send them over to one of these locations to be tested. The fact that we can expand what we were doing for the long-term care facilities, which was pretty aggressive just a week or 10 days ago, now we're saying we're going to take that statewide. I think that's a really good sign, and hopefully a good sign to the people in New Hampshire that, again, we're going to have the data that we need to move forward.
Do we have any more data on what that Hillsborough and Rockingham experience in the nursing homes has taught us? Last week you mentioned that there was some asymptomatic exposure you found. Do
you want to take that, Commissioner?
Elaborate at all? Do we know more? Thank you.
So I know that we have over 2,000 people tested out of those long-term care facilities. The vast majority of them were negative, which is exactly what we want to see. There is probably under 50 that tested positive. So initially, the very first week, I gave Convenient MD a list of priority facilities, and those facilities were facilities that had a positive person on their staff or a resident in their facility. So we got a bulk of those positive out of those facilities, which really allowed us go in and put people either off work or cohort appropriately very, very early after. For the last week, we have found here and there positives throughout those 2 communities, which has been very helpful. You'd like to think that every positive you found, is one resident that you prevented from getting COVID-19. So even though the numbers are not huge, they're still relevant and still very valuable.
Commissioner, sorry,
I was just going to say whether, and you've really been on top of these long-term care outbreaks. I know you can't probably be specific, but have there been other outbreaks that haven't been reported? In other words, in essential businesses, have there actually been multiple cases of positive that you had to respond to discreetly?
So we've had, a variety of businesses that have experienced COVID-19, even in mostly in small numbers. So let's say like under 5, under 10, and depending on how big that is, if you have a small business that has 10 employees and 5 of them get infected, that's an outbreak in that environment. But if you have an organization that has 500 or 600 employees, having 5 employees, that's not necessarily that could be a cluster of illness, but not necessarily an outbreak. So I think it's really important to look at the size of the organization rather than the numbers. And a lot of times when I'm here reporting outbreaks about long-term care, it really isn't just about the number of people that have been affected. It's the number in comparison to size. It's whether we've seen transmission within the facility or we think that we've seen transmission in the facility. So there's a lot of factors in that.
Commissioner, mentioning these added locations where people can get tested as you stand up more testing, should people who are concerned and maybe symptomatic, should they still be going to an ER, or are you going to recommend they start going to these other locations? What's sort of the guidance?
So if you're symptomatic, your first thing you should do is call your provider. That's number one. A lot of providers can do testing themselves. They don't even need to necessarily set up or send the person to these locations. There's a variety of providers right now that have decided to set up mobile testing themselves and set up a tent in the hospital parking lot or in somewhere else. So we've seen that in a variety of communities around the state, that a group of physicians come together with their health system and set up their own sites. So it really is up to the provider. When you call the provider and say, I have symptoms of COVID-19, that provider needs to make a decision on, should I bring them into the office? Should I send them to our hospital testing site? Should I send them to the fixed location site? Or should I refer them for a VNA visit? Because we have a host of people that have physical limitations and other limitations, transportation issues, that they just can't get to our sites. So the provider can send in a referral for VNA, for a mobile site, a fixed site. I think it really is up to, it's a discussion between the provider and our team. We have a coordination team at DHHS that's a partnership between us and the National Guard that's going to be taking those phone calls and those referrals.
Governor, our neighbors in Vermont are starting to reopen sectors of their economy. Where do you stand today on our May 4th?
So again, to responding to what Vermont is doing, I think Vermont is taking some very appropriate steps. Remember, they clamped down on their economy much harder than we had. They clamped down on construction and manufacturing in a variety of different areas. And I think those are the areas that they're starting to open up already. So they're kind of catching up to where we are. Remember, we didn't clamp down quite as hard as most other states. And I think that's provided a lot of flexibility and our ability to use data, I think, in a very smart way. Later this week, we'll do a pretty robust presentation, frankly, as we get some of these final recommendations and presentations in. We'll let the committees kind of look at their ideas in terms of guidance, how that might look. Everything from, again, businesses to managing public areas like beaches and parks and trails. We won't have every answer at the end of the week, don't get me wrong, but I think we'll have a couple first steps, maybe the low-hanging fruit, if you will, the areas where we think that the guidance is most easily implemented, where the benefits can be most clearly seen to the citizens of New Hampshire, and again, most importantly, where we can provide the safety for folks to actually have a little more flexibility. The actual stay-at-home order itself does expire, I believe, a week from today, and again, my hope is to be at a position where I don't think that's going away after the 4th, but we may be able to come back and augment it and adjust it and try to create some flexibilities there so people can start, again, getting back in some sense to normalcy. But please understand that the crisis in Massachusetts is a real crisis. It really is. They are our southern border. We have a lot of connectivity with our workforce, our communities, our families. And if you look at the hospitalization numbers, just in, we talked about this last week, whether it's in Lowell or in Lawrence or Boston, Worcester, Wellesley, and where those numbers are most prevalent. If you were to go on the Massachusetts COVID website, which is a terrific website, by the way, I think they do a very good job being very transparent about their information. And you look at the maps county by county in Massachusetts, the hot spots are the North Shore. The hotspots of their state, which is the hotspot of the country, is actually the counties that most directly border Hillsborough and Rockingham. So just to open things up is that I've always said it's going to be the most challenging part of what we do. The fact that you have, I'm making my answer a little longer. I hope you can bear with me. But when you look at travel and tourism and hospitality and restaurants, those are the areas that have been most strongly impacted by the COVID crisis. And you can see that in the unemployment numbers. We watch those numbers daily. So even though those facilities might be 150 miles north of the border, the vast majority of people that would use those would be from Massachusetts and Connecticut and Rhode Island and New York and New Jersey. That is traditionally 60% of their business anyways, and it would probably be much higher given the dynamics of this crisis. So to open those facilities up, even though they're well off of the border, is enticing and incentivizing folks to come across the border and potentially create another COVID surge here. And so we have to be very cognizant of that, which is why when we look at the funds that we could release, the $1.25 billion, when we talk about small businesses or businesses that for whatever reason, could not participate in the payment protection program that the federal government has put out twice now. The second tranche is coming out soon. Our job is to make sure we're kind of filling in those holes. And it isn't just to make a company whole. We're not there to replace all the revenue. We are there to make sure that these businesses can keep their doors open, can stay alive, can kind of get through this a little bit, and then hopefully grow as the economy starts to come back, hopefully, sooner than later. So, we want to make sure that as many businesses, individuals, nonprofits. I mean, the nonprofit world has been devastated by this. God bless the generosity of the people in New Hampshire. They've done a terrific job standing up for a lot of this. I think we cannot thank you enough, and keep it coming, because some of these nonprofits that do so much on the front lines of our state really need it. But that's where a lot of our efforts will go to as well, and making sure that they can be there, not necessarily to make them completely whole, like nothing ever happened economically, but allow them to at least they're going to have to trim back on some costs. We're going to have to trim back on some costs. Everyone has to manage a little tighter. This isn't 2018 anymore. We're all going to have to manage a little tighter, but getting them to a point where they can keep providing those services for their communities and for the state.
What are we supposed to read into the hospitalization increase? We had been around the 70s there, and now it seems a pretty sizable increase, 90 to 100 now.
I don't think I don't think there's much to read into it, other than it is clearly a symptom of the fact that some of the most severe cases of COVID, and where we're seeing these outbreaks within the long-term care facilities, are accounting for a lot of the increase in our COVID numbers right now. And unfortunately, those are elderly folks. Those are folks with additional compromised health conditions as well. So unfortunately, if you look at how that has played out in other states, we're right on track with a lot of those other states. So I don't think there's anything to read into it, other than just the harsh reality of this virus, that it has a very negative impact on the elderly, and outbreaks can be, given the contagion levels 2 to 3 times of what a traditional flu or something like that would be. It's a very high contagion level. It can pass from person to person very easily, very asymptomatically, which is why we're focusing our testing so aggressively on those facilities.
Could this be since the epidemic curve now, we're seeing more positives based on more testing, but you guys have always said kind of watch the hospitalizations. Mm-hmm. Could this be a little bit of what you might have been expecting in terms of the late April and May surge?
I think it's rising as expected. I would say that if you look at our overall percentage of positive cases to the number of tests we're doing, we're actually dropping quite precipitously. I think there were a few days there when we were 15-20% of our numbers of tests that we did were coming up positive. Those days we were hitting 70 and 80 about a week and a half ago. Now our numbers are more in the 5 to 10% range. And again, you could hit a spike at any moment depending on where you're doing your testing and what the situation might be. But we've definitely seen I think a positive trend in that area. We're not quite at a 2-week level, and we haven't quite met some of the, I'd call it the gating criteria that the federal government and the CDC guidelines look for to open things back up. We're not quite there. They want two weeks of good data. We're not there, but we're on our way, and that's a good sign. But we have to understand that even if we were to hit 2 weeks of positive data, and 2 weeks more and 2 weeks more, we likely are going to have COVID and going to be dealing with this issue not for 2 months, but possibly for the next 16 to 20 months. We just don't know. I mean, we hope a vaccine comes up tomorrow, but that's just not likely going to happen. And until one does, in some way, shape, or form, this is going to be with us, and we have to be reactive to that. So being able to manage these numbers, manage testing, manage PPE placement, allow that the physical distancing to really have that net benefit of mitigating the viral spread is going to be pretty important, not just today, but for quite a while. It's why, if I may, there's a lot of people that say, just open things back up. Just do it. That's an incredibly irresponsible thing to do for a variety of reasons, and I think most people understand that. But even saying, look, why don't you just open things up next week? These are what the other states are doing. If we, just by taking a week or a couple days extra to make sure we're getting it right and designing guidance for the long term, knowing we're in this for the long term, right? A year from now, we're not going to be worried about whether we took 2 extra days or a week or maybe 10 more days. It's so important to take the time, look at the data, work with public health, get the guidance, and get it right off the bat. So yes, we are not rushing things like some people would just like us to rush. That would be massively irresponsible. I'd love for it to happen tomorrow. Everybody would. But that we just can't do that, and that's unfortunate. And the Massachusetts issue is a very real issue for us. That's a data point that is a very strong variable in our decision making. But again, if we can take a few extra days or an extra week or whatever it's going to be and craft this right now, down the road, I think we're going to be in a much better place a month, 6 months, and a year down the road. Do we have some folks on the phone that want to grab some questions?
The first question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, just to follow up on that, given the importance of testing and contact tracing in terms of getting the data that's going to guide those decisions about reopening, in your call with President Trump, was there any conflict from the other governors or yourself about the federal role in providing the testing supplies or even more uniform guidance on contact tracing?
So the question is based on what we want to do with expanding contact tracing and testing and making sure that we have all this data readily available. The response from governors based on the conversation we had with the governors and the president about an hour ago, no, there was very little conflict at all, because I think the federal government has opened up a lot of opportunities. States were talking about the number of tests and how, similar to New Hampshire, they're increasing their testing numbers at the in this very much the same way New Hampshire is. They're going to have that data, which is why you're seeing other states that maybe don't have the impact that have not had the COVID impact that we have had, that don't have the proximity to a place like Massachusetts, maybe out in the Midwest or the Montanas or the Oklahomas of the world, whatever it might be. They're able to increase their testing and start really flexing some of their businesses and stay-at-home orders a little more aggressively than we are, because they don't have some of the external variables. But everyone was talking about the increasing availability of testing. I got another message from Fisher, Mark Casper, the CEO of Fisher, Thermo Fisher, who one of our better suppliers. They're right on the front lines of it. They're absolutely terrific to work with, and I got another message from him this week talking about how we can expand, and we're going to continue working with Fisher to do that. So things over the past, I think, 3 or 4 days here, I'd say since Thursday, really appear to be on the right track, both nationally and locally. I mean, I'm responding to the question that I took about 20 minutes ago. I'm never going to be really satisfied until I'm never going to just accept that, we're at 2,000 or 3,000 a day or whatever it is. We're going to keep moving those goalposts and challenging ourselves to make sure that we're getting true saturation of that data. We've tested about 1.5% or so of our population, or in terms of the numbers, right? If you look at about 19,000 tests, something like that, that's about, not just shy of about 1.5%. But some folks have been tested multiple times and all that, so you have to take that into account. But we're going to keep growing that number and making sure that if people have symptoms and they want to test, they're getting a test. That's, I guess, when I'd be satisfied, when I know that if people want to test, it's going to be there for them. We're not quite there, but boy, we've really accelerated it, and we're very happy with not just where we are today, but I think where we're going. I think the Department of Health and Human Services has put together a terrific strategy and a plan to get us from A to B and now moving on to C.
The next question comes from Paula Tracy with In Depth. Paula, go ahead with your question.
Yes, good afternoon, Governor. Can you give us a take on the state's current fiscal health? And have you asked agencies in the state to pull together reduction plans, and whether or not there might be some staffing issues that have to be addressed?
Sure. So the question is really around the fiscal health of the state. Right now, I'm going to take the $1.25 billion and put it to the side a little bit, because technically that's giving the state a lot of cash and a lot of liquidity. It is literally sitting in our bank accounts now, but that's really going to be reserved for direct COVID-related issues, some large and small business supports in a variety of different ways. So let's just talk about the basic physical health. Even just on a cash basis, we're okay. We actually are okay, but we don't suspect we will be for very long, to be honest. There's a lag time between the health of your economy and the amount of revenue you're bringing in, because a lot of the revenues that are coming in over the past few months have really been generated by profits and the economic situation prior to COVID. As we hit September, as we hit November, December, as we go on to this year, and I think we're going to more see the true economic impact, not just to businesses, but in terms of the revenue. It's one of the reasons why a lot of governors and a lot of states are fighting for more revenue out of the federal government and some supports there, because, again, a lot of these states, like us, We looked at the CDC guidance. We took a lot of the national recommendations about what to do and how to scale back not just our economy but our stay-at-home orders and make sure that we're increasing physical distancing. We followed those guidelines, and again, it's had a real negative economic impact on us. I do believe that it would be great if the federal government were to step up and allow some financial support, whether it's similar to what you saw in the first CARES Act, whether it's something a little different with what shared responsibility of managing costs and getting some help, more flexibility. It could come in a variety of different ways. So we're open to a lot of ideas, and we're expressing our ideas down to Washington, putting as many options that we can think of on the table, because that support needs to be there, not just for the state, but also for cities and towns. They're undoubtedly going to see a pretty severe reduction. So with all of that in play, I was on a phone call with all the mayors, the Municipal Association, a variety of folks late last week, where I told them very clearly, you need to start planning for the worst. That's what leadership is about. It's not about just hoping for something and telling everyone everything's going to be okay. You got to set expectations where they really are going to be, and that means being tight with their costs. Be careful about. We've already instituted some hiring freezes here at the state level. I think cities and towns probably need to be doing the same. We haven't canceled, but we've postponed some of our capital projects. Again, seeing what the federal government might be able to provide. I think cities and towns should be looking at that too. When you look at discretionary dollars, we've halted most of the discretionary dollars here in the state. I think cities and towns need to be doing that too. They need to be very careful with their dollars, or they're going to get themselves into a tough situation, as the state would as well. So I've talked to all of my commissioner heads this morning. We had a very robust discussion on a variety of things, and one of them was this. We talked about the hiring freeze that's currently in place. We talked about, again, we haven't canceled any programs or cut anything out of the budget as of yet, but we are looking to postpone a few things. And again, you got to see what the federal government might be able to provide. Now, the good news is we think the federal government should get us an answer, hopefully in the next few weeks. And so, again, we're planning to see what might have to be done if we hit real catastrophic levels. But my guess is the federal government will be able to support us in some way. And so we're not cutting anything or making any commitments on the downside, because we do think that the federal government will be able to help us. But look, any good manager has to plan. And so we're looking at all the different options that are on the table, all the different programs that are out there, finding programs that might be redundant, finding programs that might be outdated, or finding programs that are directly COVID related, so we can use some of these COVID relief funds to help support them. So there's a variety of ways to fill in the gaps, if you will, but without a doubt, everybody from cities and towns to the state government, frankly, all the way up to the federal government, we're all going to have a collective responsibility of tightening our belt and managing costs.
The next question comes from Michael Graham with InsideSources.com. Michael, go ahead with your question.
Governor, if the Secretary of State's Election Commission that formed today recommends an all-male election for either the primary or general November or both, would you be comfortable with that? And would you be comfortable with going to an all-male system permanently, the way Oregon, Colorado, and other states?
I apologize. I'm going to answer the second part first and ask you to repeat the question if I could. So I don't know what other states are doing with their election systems, and I don't want to use the term I don't care, but we do things different in New Hampshire. We have a whole different level of a bar that we set for ourselves in terms of integrity. So we always just want to make sure our system works for our citizens. I couldn't hear the first part of your question, though, Michael. I apologize.
No, I apologize. So the Secretary of State, as you know, the new commission group is meeting to decide what to do about the upcoming elections. The federal funds are available. If they recommended an all-male election for the primary, the general, or both, would you be comfortable with that?
Oh, so the question is, if the new commission that is meeting, it's just starting to meet now, if they were to recommend an all-male election, an all-mail-in election, no, I wouldn't be comfortable with that at all, for a variety of different reasons. We have a very robust absentee ballot system that allows for flexibility. It's the absentee ballot system that we have. It isn't an all-mail in a primary or election system. And it's our guidance documents that the Secretary of State has endorsed and put out in conjunction with the Attorney General's office provides a lot of flexibility. I mean, more flexibility than anybody could actually need in terms of wanting or needing an absentee ballot and voting from home. They can do that. So that's already in place. If a commission were to go beyond that, I would find it hard to understand any of the justifications for that, given that our system already allows for a lot of flexibility.
The next question comes from Sarah Gibson with New Hampshire Public Radio. Sarah, go ahead with your question.
Hi, Governor. Schools are expecting to hear, I believe by mid-May, whether it's going to be safe enough for them to open buildings this summer to offer extra support to students who fell behind. And I'm wondering if you can talk a little bit about how you are making this decision about when it's safe to reopen school in the summer, and if schools can't reopen, do you expect interventions and remedial support programs to be offered online through the summer?
Yeah, so the question is about summer learning programs, essentially, if schools were to reopen for summer programs or the extracurricular programs that they often provide through the summer. So first and foremost, we'll always be looking at the data to see if we can get there to the point of opening those facilities, but I can tell you we're already making preparations to do the vast majority of summer programs and available via online learning. And how we make those decisions of opening schools is how we'd make decisions, I believe, similar when you're looking at let's say kids' summer camps with the Boys and Girls Clubs, or kids' camps up in the Lakes region, or whatever it might be. We're looking at all the different aspects of when you bring children together in large groups, larger than 10. You know, we still have our limit right now of 10, and that could move in terms of social gatherings. And again, really, technically, with the stay-at-home order, we've even suspended that. But if we can flex out of the stay-at-home order over time as we get to the summer, the June and July months, as we can start looking at flexing open some of the facilities, you also have to consider whether parents would feel comfortable bringing their kids into those types of atmospheres. And so that's an external variable. You know, this goes for businesses and schools and hospitals. I mean, we could open everything up tomorrow, but the fact of the matter is, A, that wouldn't be responsible. And secondly, what would people feel comfortable coming in? Would people feel comfortable bringing their children into those situations? Anything we do, we want to ensure the cleanliness and disinfecting and the safety of those kids. But we know that the asymptomatic transmissivity is a very significant issue with children. And so any of those decisions to be made, again, will be done in conjunction with public health, looking at data, and looking at, again, whether it can be done in a practical way. Not just, it might sound good on paper, but if it can be practically done to provide a net benefit for those kids and those families, all that has to be taken under consideration.
The next question comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead with your question.
All right, thank you very much. Can someone, Governor Laurie, tell us a little bit about the state's monitoring of more than 2,200 folks for the COVID-19? I mean, are they monitored in similar fashion, or are there different protocols? And are they monitoring those with signs and symptoms, but not confirmed cases, or just confirmed cases? And lastly, how many staff does it take to do this?
Thank you for the question. So, yes, 2,400 people we are monitoring. Our monitoring has changed over the last couple of months. When we first began COVID-19, we were in a what we call a containment strategy. So every single person that was positive for COVID got the first phone call and then multiple phone calls a week to check in with them. And then additionally, every person that was a close contact to that person got the initial phone call and multiple phone calls per week. So right now we are still contacting and following all positive cases with the initial phone call and several phone calls per week to check in with them, make sure they're doing okay, make sure that they're maintaining isolation and quarantine. The close contacts are typically getting a phone call telling to quarantine for 14 days and then saying, reach back out to us. We have more regular contact with, let's say, the positive cases in institutional outbreaks or facility outbreaks or with businesses. So with our long-term care partners, if we have a positive case, although we're in contact with the nurse for that positive case probably every day, we're contacting the rest of the facility to check in on different residents with symptoms. So it's a variety of things, but it requires multiple phone calls to people multiple times a week. Right now we have, I'm going to give an approximate about 75 people in that bureau. They're not all doing contact tracing. They're not all doing those phone calls, but there's a great, robust team of public health nurses and infection control specialists that are doing it. And that's part of what we're doing with the National Guard, is that as we ramp up testing and we find more positives in our community, we have to ramp up that that contact tracing. We want to continue to make that phone call to every single person and to follow up with every single close contact. So because we want to continue with those efforts, we need more help. And so the National Guard are great partners, and they're going to be sending us several guardsmen to help us with those efforts.
The next question comes from Rick Juergens with Valley News. Rick, go ahead with your question.
Yes, Governor, you talked about the testing underway and to reach out to the long-term care facilities around the state, and I presume that's part of or that would move towards meeting the federal guideline of sentinel surveillance in facilities that serve older Americans. But they also talk about lower-income Americans and minorities and Native Americans. What is your goal for the state to get to in terms of the type of sentinel testing or sentinel surveillance that you would feel would enable the state to monitor and be on top of any future surge?
Sure. Great.
Thank you. So I'm assuming that your question in regards to long-term care and sentinel reporting is around CMS guidelines of nursing homes needing to notify residents and families of even a single case, and that helps with being able to contain. When you look at long-term care facilities, you almost look at that facility as a community in and of itself. So even though in a lot of our state we went into mitigation, in long-term care facilities we stayed in containment, and we will stay in containment for the duration of COVID-19. So I think that is probably what you're referring to. As for minorities and people with accessibility, we used a lens for that when we did our testing strategy. So one of the reasons why we contracted with the VNA was exactly that. We wanted to make sure that people that had disabilities or people that could not get to our testing sites had access to appropriate testing. We also have the Office of Health Equity at the table in our testing strategy to make sure that we are able to stand up testing and do mobile sites in areas of poverty or in areas of our communities that have maybe poorer access to services, to make sure that we have mobile testing sites to make sure everybody has accessibility to these tests.
Okay, I think we're good on the online questions. Any other questions from folks here? Yes, sir.
With regards to reopening in stages, how do you decide, priorities and which sectors will be?
Yeah. So in terms of how we're going to start reopening our economy and our communities, how do we prioritize? It's not easy, to be sure. First and foremost, we look at the public health aspect. So if there's certain areas that can be opened sooner than later because of just the natural physical distancing, the natural barriers that are already in place, those natural areas of natural ways of operating that won't allow for viral spread, that obviously makes it a lot easier. There are certain I don't want to say I'm not saying we don't look at the economic impacts, but the economic impacts are a little bit lesser than the societal impacts. So, for example, we're going to look to open hospitals in some way, shape, or form in short order. When we talk about elective surgeries or procedures, there's a lot of opportunity there. I've talked to a lot of dentists. I think the dentists go massively underrepresented in this crisis because virtually everybody goes to a dentist, and a lot of times a lot of folks see dentists a lot more than they see their own doctors. But there's a very high risk there because of the nature of being working with somebody's mouth and saliva and all that sort of thing, and things being able to aerosol very easily in a dentist's office. So that's a kind of a high-risk, high-need area. A lot of dentist offices are smaller. They're not part of giant hospital conglomerations. They usually don't have the cash and on hand, per se, to stay open for long periods of time without business. So everything's a little bit different. We talk about barbers and salons, and something that I don't think people realized was a priority until I'm doing my best with Jill here. I think we all are. I noticed Adam is wearing a hat now at each of these press conferences. But in all seriousness, there are actual guidance that we could probably put into place to allow them to open fairly easily, and with our ability to have PPE available to them now. So certain things have risen to the level of priority, if you will, partly because they're a community need, partly because they're just easier to do because of the physical distancing and our availability of PPE. And there are some obviously economic needs there as well, and we're not ignoring that, but that's really last on the list right now, because the economic impact of this crisis isn't just going to go away tomorrow. It's not. That would be a very easy thing to rush to, but the biggest economic impact is around hospitals and restaurants and travel and tourism. The hardest things to open, not hospitals, hotels, not hospitals, hotels. Hotels, restaurants, and travel and tourism. The hardest things to open are hotels, restaurant, and travel and tourism. So that's just one of the very tough dynamics there. It doesn't mean we can't do it, but it means we may have to wait a little longer, have a little more data, see where Massachusetts goes, because those are the customers who would be enticing to come over the border to use those facilities, and see how it would play out regionally. So that's why we have this task force, legislators, stakeholders. They're all having their input on both the guidance document and how that potentially could be done. But even if we have those guidance, the timing is very, very important. And I know that could be a source of frustration for folks. We may have a great piece of guidance document, but for certain reasons, we just have to wait a little longer to get things open. We may have a good guidance document and things, rise to the front. Maybe start opening up next week, the week after. Who knows what it would be? But it's going to be we're looking at it at a very granular, specific level. We're not just saying open it all up, just do all this. We're really getting all the input and the data we can and using public health to help make those priority decisions. Sorry for the long answer, but it's one of the more, I've always said it's really the most complex thing and the most difficult decisions. I've already made the most difficult decisions I ever imagined I'd ever have to make, and I know the next ones I have to make are even harder than that. And that's why you have to rely on, and God bless it, we've got a great team at the state, a phenomenal team at the state. And they are the ones that really deserve a lot of the credit for the fact that we are essentially a suburb of Boston, and yet our numbers are so low. I mean, it's a virtual miracle, but it's not by accident. It's by design. It's because we were smart in terms of how we rolled this stuff out, because we had people that took this very seriously, and we were very aggressive about our physical distancing, and it worked. It worked really well. I can only imagine. I mean, there's no reason to think it would be any different than Massachusetts if we just went about things the way we had been doing, and that would be a travesty. I mean, we'd be in a real worse situation. So we've made smart decisions and tough decisions. We're going to keep doing it. Okay, well, thank you, folks. And again, we had a lot of, I think, good news today in terms of where we're going with Gopher, with PPE, with testing, with the Open Up New Hampshire Committee. There's a lot of really good stories here. The folks in the National Guard continue just to knock it out of the park. Hundreds of them doing things that we never imagined and thought we'd have to ask them to do. These are all really good stories, but at the same time, let's also appreciate we had 77 new cases today. And God bless it, we had another, every 0 day of, when you talk about the deaths in this state is a good day, but we also have three more outbreaks to report today. And we know, unfortunately, there'll probably be more bad news on the horizon. That's just the nature of this. So again, we just want to thank everyone for being a part of it, for that sacrifice they're making in their homes. We have been able to keep our numbers down overall, but we have to stay disciplined. And if we do that, I really think good things can come. They are on the horizon here. We're not quite there, but they're on the horizon. We've got a great team making opportunities happen. So thank you all very much.
And you just listened live to state officials giving us the very latest on its coronavirus response. So here is what the coronavirus number stands right now in New Hampshire, what it looks like right now. 60 people have died. 1,864 people have tested positive for COVID-19 rather. 1,938 total cases rather. And there were 75 new announced cases today, with 90 to 100 individuals hospitalized each day so far. At least 779 Granite Staters have recovered. And there are some new outbreaks at long-term care facilities in New Hampshire. They were at Birch Hill, Manchester, 7 residents as well with 4 staff. Crestwood Center in Milford, where 14 residents and 4 staff were affected. And Salem Haven in Salem, where 9 residents and 2 staff were impacted there. And let's take a look right now at these new testing locations that the state says is part of their ability to ramp up testing. They are in Lancaster, Tamworth, Plymouth, Rochester, and Claremont. The state says these facilities will help those without access to a hospital or urgent care facility near them. They would like to get to 1,500 tests a day. And again, thank you so much for joining us for this live update. We'll have much more coming up tonight on News 9 at 5 as well as online. See you then.